Let it be known. Good morning. Everyone knows that African Americans are disproportionately affected and dying because of COVID-19. But according to the latest statistics compiled by the independent nonprofit KFF, which focuses on national health issues, as of January 19, 2021, over 12 million COVID-19 vaccines have been administered across the country. But, of course, African Americans are being left out. The access is not there. It is one reason why Dr. Ebony Hilton of the University of Virginia and Goodstock Consulting is calling on the Biden administration to create a new cabinet position titled Secretary of Equity. Here to talk about that and the virus is Dr. Ebony Hilton. We really appreciate you. Dr. Hilton, welcome.
You're welcome. Thank you for having me.
Oh, absolutely. And of course, joining us is our boss, the president of the National Newspaper Publicists Association, Dr. Ben Chavis. Good morning, Dr. Chavis.
Thank you very much. And thank you, Dr. Hilton, for once again being with the Black press of America.
Yes, for sure. Thank y'all for always giving a voice to things that truly are important to our community. So thank you.
Our privilege. And Dr. Hilton, so let's talk about this Secretary of Equity. Why is this important? I know you have a change.org petition going as well. So talk about that, please.
Yeah, I've thought about this idea of Secretary of Equity for a while now, but just thought I should formalize it and put it in a petition to say we need to make this happen. And the reasons why is with COVID-19, we oftentimes talk about how this is unfairly, targeting Black people, that we're dying at higher rates, that we're carrying this load of infection and hospitalization at higher rates. But the truth of the matter is, Black people, we've carried the burden of injustice for all categories, whether that's housing, transportation, commercial development, industrialization of our communities. We have always fell on the short end of the stick. And in order for us to truly progress as a nation, we have to make right what is unjust. And it's literally in our preamble of the Constitution. We say we the people of the United States, in order for a more perfect union, we're in pursuit of establishing this justice. We pledge allegiance to say liberty and justice for all. Well, when are we going to start to actually act like that? And put as much emphasis on equity for all citizens as we do for the Department of Defense, for instance. It's time for us to make change and prioritize our citizens.
And Dr. Hilton, so this Secretary of Equity, it would come with an entire department. Is that what you're proposing?
For sure. And because, again, what we know is that if we're looking at metrics out of all of the different departments, if it's, HUD, our Health and Human Services, we know that there are disparities that lie within each of those sectors. We know that African Americans are less likely to own homes, that we're more likely to be in financial debt. We know that our children are more likely to be, suspended or expelled from school, and that our schools are underfunded and under-resourced. We know disparities exist across the board in all of those industries. And so the idea is that you will have a Department of Equity with the Secretary of Equity that formulates these metrics of what each of those departments, what should we be looking at for the policies that are coming out of those departments? Where are the monies being allocated and where are those resources being placed within communities at large, right? And the idea is that you have actually representatives in each of those departments. So in the Department of Health and Human Services, there'll be a person there that literally is looking at along the lines of equity lens. What are the policies that we're writing? Where are the monies going to each community? And not just along the lines of race, but race, gender, sexual orientation, all the marginalized communities that we see in the United States that unfavorably are impacted by these policies that we put out. I mean, we're looking at our budget. We have a discretionary budget of 1.3 trillion, a mandatory spending budget of 2.7 trillion. Where is this money going? Where are these resources going? And if they are going to those marginalized communities, would we see the outcomes that we see across the board? And my thought is that no, that we will start to see some changes in our communities that can help for the next generation to not have to suffer the same consequences that we have.
Now, Dr. Hilton, you also have a petition on change.org. How many signatures are you seeking? And after you reach that, if you haven't already, what's the next step?
Right. You know, we initially sent this this memo out to the Congressional Black Caucus because we know they are doing fantastic work in pushing, you know, the federal government to do more for us as citizens. And then we thought, let's take it actually to the people, because if we speak to each individual person, what we know is that everyone recognizes what's going around. We don't know exactly how to put legs to it, but if we organize, if we combine those voices, then that's a force to be reckoned with. I didn't expect to have really only 5 or 10 people to even take notice of this, because you always feel like you're such a small voice. But we've now had, I think we're close to 1,300 people that have signed on to this petition. It's only been up for less than a week. But the idea is that we'll take these to the powers that be to say, we at Goodstock, my consulting firm, we literally have laid out a framework of how this can look. This is not going to be a easy lift at all, but it's a necessary lift. It's one of those things where if you show me where you put your money, I'll tell you what your priorities are. And truly, again, if we're pledging allegiance to this flag for liberty and justice for all, then we need to put our money where our mouth is. Start to put in some accountability to these data points that we see generation after generation after generation. Things have not changed for Black people. Things haven't changed because it hasn't been a priority to change. So our next step will be to take this signed petition, to go back to the Congressional Black Caucus, to go to our elected officials, to go to the Biden campaign and say, this is what we need. President Biden has made some steps and some efforts, but what we see is just like he did executive orders to completely, erase the clauses that President Trump put in place, like the transgender ban and Muslim ban, those types of things. One signature and that can go away. If we have an established Department of Equity within the federal cabinet, then that's not something that you can easily just remove. And we want that. We want it in the federal, we want it on the state level, we want it on the local level, of where equity becomes a normal practice and not an afterthought.
Yeah, and Dr. Chavis, I know during the this week's midwinter training conference, the NMPA is hosted this week. The COVID-19 is at the forefront, and one of the concerns, Dr. Chavis, is the access that African Americans has to the vaccine.
Absolutely, and again, we want to thank Dr. Hilton and the doctors that work with her at the University of Virginia, and thank you, Dr. Hilton, for being a part of the NMPA Coronavirus Task Force. We're going to hear from Dr. LeBird from the Center for Disease Control. But I would like to ask you, Dr. Hilton, what do you see as the forecast? As of yesterday, over 425,000 Americans have died from the coronavirus. Can you just, again, share with our audience how deadly this virus is, particularly to Black America and other people of color?
Right. What we know is that not only are we dealing with the wild type or the original COVID-19, but now we have these mutant strains that are now coming out in the UK and South Africa, and quite frankly is in over at least 20 of our states here in the United States, and it's probably in every single state. We're just not doing sequencing. And what does that mean? We know that these mutant strains are more contagious and more easily spread amongst us. And unfortunately, what we're seeing is that just as COVID-19 actually likes to infect our community, in that we are the essential workers, we are the ones that are being forced to go out of our homes and not be on these Zoom conference calls like we're doing right now, because only 1 in every 5 African Americans can work remotely from home. Only 1 in every 6 Hispanic Americans can work remotely from home. Because we're in that uphill battle of having the generational housing, of where we have multiple persons that we can spread this within our home, there's no safe spot for us. We are getting more infected, and unfortunately, we're dying at higher rates. 2.7 times more likely to die from COVID-19 if you're Black versus if you're white. And on the other end of that, when we're coming down to the intervention, the thing that can possibly save our lives and prevent COVID-19 severe infections, the vaccine is not made available to us. When we're looking at the allocation of how this vaccine is rolling out, phase 1A being healthcare workers and persons who live in a nursing home, well, 60% of healthcare workers are white. 78% of nursing home residents are white. It costs money to place your family into a nursing home. money of which Black people, unfortunately, because of the wealth gap, we don't have an excess of. And even if we're looking at phase 1B, initially they were talking about any persons over the age of 75. Unfortunately, Black people, we have a phenomenon of a paucity of life because our average life expectancy is only 75. In fact, only 9% of the U.S. population over 65 is Black, and yet we make up 19% of those over 65 who have died from COVID-19. So the allocation is not being met with a equity lens, and that's the point. That's to tie in the Secretary of Equity. It's because equity is always thought of as an afterthought. It's not in the foundation of structure or plans. And when that happens, disparities will continue to widen. So we must make changes and have someone at the table from the very beginning.
Yeah, and it's not too late for everybody to register for the NNPA's Midwinter Training Conference at www.virtualnnpa2021.com. It's free to register, and you're going to get some great information, just like what Dr. Hilton is dispersing this morning. Dr. Hilton, I saw the stats in Pennsylvania, for instance, of those who have received the vaccine. 95% of those who have received the vaccine are white. Can you talk a little bit about access for the Black community?
Yes, for sure. Oftentimes, again, when I say this is a systemic problem, we have a systemic problem of racist practices and racist policies within the Black and brown community. Just like we have food deserts or food apartheids, where there's not a healthy food eatery within miles of a person's home in the Black and brown community, we have hospital deserts and we have pharmacy deserts. In fact, when we're talking about, oh, yes, the vaccines are going to be distributed through CVS and Walgreens, and everyone clapped, my first thought was, then you're not including Black people. Because what we know is that 70% of our pharmacies and drugstores are in predominantly white communities. If you're in a predominantly Black or brown community, you are more likely, twice as likely, to see your hospital system closed than if you're in a predominantly white community. So and this isn't new. This hasn't changed. This is pre-COVID, and this will likely be after COVID if we don't do anything about it. But the thing that disturbs me greatly is that we've had 12 months now of this pandemic. Our first case of COVID-19 was on January 20th, documented in the United States. And so my question is, we've been praying for a vaccine for 12 months. So why is it all of a sudden in December, we're acting as if this caught us by surprise? We knew that we didn't have those healthcare access points within the Black and brown communities. And yet we allowed it to still happen, which tells me that wasn't an issue of priority. The emphasis wasn't placed there to put resources there to allocate and distribute this to the most vulnerable people. Because again, if Black and brown people are dying at higher rates for COVID-19, they should be the first persons in line for the vaccination. And instead, the government is very, very easy to say we should allocate along the lines of age, right? They're very quick to say if you're 75 or older or 65 or older. But when it comes down to listing race, all of a sudden they want a race neutral policy and a race targeted disease process. And that is simply not just.
Yeah. And, Dr. Anthony Fauci spoke just yesterday about something he termed post-COVID syndrome, where there are other after effects of the virus from those who've had the virus. Can you talk a little bit about that as well?
Right, for sure. If we're looking at the percentage of persons who've had COVID-19 and then recovered, right, or at least their active phase is now done, 3% of those whose active phase is now completed have died. Right? But the 97%, oftentimes you'll hear people say, why don't you ever talk about the recovered? Well, let's do that, because in that recovered, I have people literally in my ICU right now who are recovered from COVID-19 on a ventilator, waiting for a lung transplant. They are not old, they're young. And when I say young, I mean less than 60 years old. And waiting for a lung transplant because their lungs no longer work. But according to the numbers, they are recovered. There are people who also have, have lost limbs because the inflammation, the inflammatory process causes blood clots to form. So they've lost legs, they've lost arms, their kidneys no longer work, and they're dialysis dependent. You can go on and on, but one of the new phenomena that we're seeing is that people complain of what they call brain fog. of where they literally can't concentrate. And it's not for weeks. This is literally, people are saying, for 6-8 months since they've had the COVID-19 infection, they no longer have that ability to concentrate. And what does that do when we're talking about the casualties of war? When we're talking about this pandemic, there's many things left in the wake, and there are health consequences of these COVID long haulers. There's financial consequences. We have to deal with the issue of orphans, right? We know that we're unfortunately seeing children left without parents. All those things tied in. If you're more at risk of dying from COVID-19 and more at risk of getting infected from COVID-19, you should be the first person in line to hold your arm out so you can get this vaccination.
Dr. Chavis?
Yes, Dr. Hilton, how's the access there in Virginia? What's your analysis? How's Virginia in this distribution or making the vaccine available to people who really need the vaccine?
Right. Virginia, unfortunately, is being met with the same challenges, I think, that across the nation, in a failed strategy from the top down. If you don't have a federal leadership, then it's hard to actually allocate and get things structured on the state level. Virginia was ranked, I want to say we were 48th or 49th in the nation as far as vaccine allocation. And we have to remember when we're looking at this vaccine and the rollout and the failure that has been the rollout, that we can't paint the nation with a wide brush, because we see there's different issues. In New York City, for instance, there's a supply lacking, right? They don't have enough vaccines. Now, New York City also has 64 hospitals, so they can have those persons to give out this vaccine. But if you're going to other areas, like in South Carolina, for instance, where 8 counties literally does not have a hospital in those 8 counties, then you're going to run into an issue where you may have supply, you just don't have personnel or establishments to be able to give it out. And so we're going to have to start thinking differently on this, about the way we approach medicine in general to get this out. We're going to start having to dip into some emergency funds. Look at FEMA to say, how can we set up these makeshift camps to vaccinate people and pay for persons to be out there 24 hours to get this into arms until we can get our hold on this pandemic.
Yeah, let it be known. Good morning to Lynn Spivey and David Youngblood and all those watching on Facebook, YouTube, and on Twitter. Dr. Hilton, so access, prior to the vaccine distribution, we did, the NMPA, Black Press of America, did a story about access, because we know that there's been a lot of talk about Black people in general not trusting medical science, but the issue now is not necessarily trust as it is access.
Right. And trust is definitely a big thing. I always lead a discussion to saying, Black people, I completely understand. When it comes down to it, we know Tuskegee, we oftentimes say, oh, that's history, but Tuskegee was from 1932 to 1972, which was just 10 years before I was born, which means my mother was alive, which means my grandmother was alive. But if we look at what Tuskegee was, right, what I don't want this to be is a Tuskegee 2.0, because why? Tuskegee was that they asked Black men to come in and they told them they were going to treat them for bad blood. Now, bad blood could have been anything from hypertension to diabetes. So Black people came in and said, okay, you're going to give me a medicine to treat me. But the truth is that in those 40 years, they just wanted to see, if we don't treat you for syphilis, what happens to your body, right? And in doing so, 28 men died. Another 100 died of complications related to syphilis. 40 wives were allowed to be infected, and 19 children allowed to be born with congenital syphilis. And this was all with the U.S. public health system, knowing that in 1947, the cure for syphilis was penicillin. So for 30 years, they allowed this study to continue. Now, Black people, what I don't want to happen with COVID-19 is, for the last 12 months, we've been studying why does COVID-19 kill Black and brown people at higher rates. We now have a medicine that could potentially save your life. What I don't want to happen is that medicine is not afforded to you, because if you don't get that medicine, if you don't get that intervention, then that is Tuskegee 2.0. So we need to start demanding that this intervention be made available to our people, so that we can live to grow old with our children just as well as everyone else.
Yeah, absolutely. And Dr. Chavis, obviously, you can speak about the Tuskegee Tuskegee experiment as well. I mean, obviously, you've talked to people about it. Do you feel that that's also an issue here, where African Americans are just still distrustful, Dr. Chavis?
Well, I think that the African American community, we need the information, and that's why what we do here with the Black press is so important. I think we should learn from history, not repeat from history. We should learn from what happened at Tuskegee, as Dr. Hilton has eloquently stated. But now we also have to demand access to medicine and vaccinations that will save our lives. That's what's at stake in 2021. We're not back in the 30s, 40s, and 70s now. We're in 2021. And I agree that we need to make sure that our demands match reality. So I think the lack of trust factor, Stacey and Dr. Hilton, we can overcome that. But what we have to really push for now is having access. I know people have to go across state lines to get the vaccine because in their home state, it's just not available. And even though they're quote unquote eligible. So I think this whole access. Now, President Biden and Vice President Harris, this task force that they have, they're going to start having briefings now from the new federal task force on the coronavirus. And I know top of that issue is access. Now, the federal government has announced yesterday that they're buying more vaccines. But even if you have 100 million, 200 or 300 million vaccines, how are those vaccines going to be distributed? And where do Black people fit in getting the access? I think that is the question that is before us today. And we in the Black Press Coronavirus Task Force, that's what we're going to be pushing. And also, we're going to help Dr. Hilton with this campaign to have a federal department of equity. I think it's so important across the board that we don't get our concerns, our health interests, triage by those who say they care about us, but we have to look at people's actions. We have to look at government's actions and not just what they say, but what they do.
Yeah, absolutely. And our executive administrator, Claudette Perry, writes in that many African Americans she's spoken to have said they are waiting to see how other bodies handle the vaccine before they feel comfortable enough to take the vaccine. And Dr. Hilton, you have received both shots. Can you talk about that and Ms. Perry's comment there?
Yes, I actually was the first person to be vaccinated at the University of Virginia on December the 15th, and I received my second shot, Pfizer, on January 5th. My grandmother, I talk to my family often. I don't come from a medical family, and I understand the distrust that exists within the system. And I talk to my grandmother ad nauseum about what is it, what are the fears, what are your concerns? Let's get through this. And I'm glad to say that she received her first vaccination about 2 weeks ago. So she should be nearing the time for her second one at this point, and has done fantastic. Not only her, but also my great aunts and uncles. Now, what we know, this narrative of the distrust, the point I made to my grandmother was always sit back and look and see what other people are doing. Because the very persons that were saying that the COVID-19 is a hoax and that we shouldn't have to wear masks and holding these big political rallies, when it came down for this vaccine being available, they jumped over my 80-year-old grandmother in order to be at the front of the line to get this vaccination for themselves. The rich and the elite, the Lindsey Grahams, the Senator McConnell, Vice President Pence and his wife, they have all been fully vaccinated at this point because they know it can save their lives. And to bring home another point, as far as is this a priority to keep Black and brown people alive? Again, we know that Black and brown people are dying at higher rates, but at this point, as far as states actually reporting who has been vaccinated, only 12 states are reporting along the lines of race, only 12. Because they don't want you to know, Black people, that you're getting vaccinated at a lower rate, that we have only a finite number of vaccines. Once these vaccines have run out, what we see is there's been this political grab of where literally right now in Germany, they're telling the EU that if we produce these vaccines here, we don't want these to be shipped overseas. We want to keep it for our people because we're dying. We're going to run into issues here if we continue to wait and to put off. we may run into an issue of where there aren't enough vaccines at this moment for you to be able to get vaccinated. We're already saying we may not give you the second shot in the time of 21 to 28 days. We may have to push that out to 6 weeks because we don't have enough vaccines available. So I just ask everyone to take a step back and look and see who's getting vaccinated. Look and see who's pushing to the front of the line. And if you are at more risk of dying from COVID-19, and if this is our intervention to help see 2023, then definitely sign up. Ask questions for sure. I post all the time about my reactions or lack thereof from the vaccine and how I'm feeling. But I literally had nothing. So
yeah.
Very good. I'm planning to take the vaccine next week. I have to go down to North Carolina because that's where it's available. And so I'm going to definitely get it, and I'll let everybody know, because I think that this is a matter of life and death. This is not a matter of political debate. This is not a matter of ideological debate. You put yourself and your family at risk by not first of all, not wearing the mask, not washing hands, not social distancing. But ultimately, you got to get vaccinated if you want to protect yourself.
Right.
Yeah, absolutely. And coming up, we have Dr. Patricia Cummins, a clinical nurse manager at the United Medical Center, who actually gave the vaccine to Vice President Kamala Harris. Dr. Hilton, we can talk to you all day long, nonstop. We really, really appreciate you so much. We're not going to hold you hostage. We know you got patients and everything else to do, but we really, really appreciate you joining us this morning.
Well,
and Dr. Hilton, thank you. We're going to be having a formal meeting of the NMPA Coronavirus Task Force, and I've already recommended that you co-chair that task force.
Well, I would be more than happy to do it. Like I said, at this point, for every 735 Black people who were alive last January, one has died. So the more that we can talk about this, the more likely we're going to be able to keep our people alive. So I'll be more than happy to be there.
Thank you so much.
Thanks for joining us, Dr. Hilton, and we will see you again. Let it be known, Dr. Ebony Hilton, fantastic physician and an even better person. Nurse. Is it nurse or Dr. Patricia Cummins? Well, she's the clinical nurse manager at United Medical Center and an MSN student at Walden University. Nurse Cummins gave the vaccine to Vice President Kamala Harris. Welcome to Dr. Patricia Cummins.
Good morning, Stacy and Dr. Benjamin. Good morning to you. Thank you so much for having me. And it is Nurse Patricia Cummins.
Very good.
To come in the near future, but for now, it's Nurse Patricia Cummins.
Well, we're trying to give you a promotion now, so.
I receive it.
Absolutely.
Well,
thank you for your work, and you made history by giving the COVID-19 vaccination to Vice President Kamala Harris.
Yes, sir, and it was truly an honor. To be quite frank with you, when it actually happened, and a few days after, I hadn't realized the magnitude of what that really meant, And it wasn't until a few days after that it actually sunk in that, wow, Patricia, you actually made history. You're a part of history by inoculating the first female vice president and the first African-American female vice president of the United States of America. So again, it is truly humbling. Still an honor, still surreal, and I am grateful.
Well, Patricia Cummins, one of the things that stands out, okay, so Vice President Harris, the first Black vice president, first woman vice president, but she got the vaccine from a Black nurse, clinical nurse, and Southeast Washington, D.C., which is, we say predominantly Black. It's just about all Black in Southeast Washington, D.C. Talk a little bit about the significance of that, and of course, United Medical Center.
Yes, sir. So her choice to be vaccinated at United Medical Center, which, as you mentioned, is in the heart of Southeast DC, was exemplary, and I think a true demonstration of what servant leadership is about, which is about serving your community and serving your followers. And by her act, she sent a message to the community that you're not forgotten, that we care about you, and also to empower them to follow suit, and it worked, quite frankly, because immediately, the days following her vaccination at United Medical Center, we received tons of inquiries about being vaccinated there. So I am just proud of her and admire her choice of place for being vaccinated.
Yeah, because she easily could have gone to Walter Reed or anywhere else. And you mentioned the response, and we were just talking with Dr. Ebony Hilton about access to the vaccine, Nurse Cummings. Can you talk a little bit about that? Because we know that, again, we talked about Southeast DC and United Medical Center being in the heart there of an African-American community. What are you seeing at United Medical when it comes to African-Americans and their being vaccinated and their sense of the vaccine?
Well, a couple of things, Stacy. One, there is a feeling of hesitancy and skepticism in relation to embracing or accepting the vaccine. I think a lot of our Black community, not just in Southeast DC, but nationwide, are justifiable in their skepticism. And I truly believe, in as much as I am a proponent for the vaccine, as I have been vaccinated myself. I've received the Pfizer version of the vaccine and I've completed both doses. As a healthcare professional, I strongly believe in informed consent and making an informed decision. Which is why I have been using my voice and the platform that has been afforded to me to share information and to educate whoever is willing to listen about the benefits and the efficacy and the safety of taking the vaccine. But just going back to the skepticism, it is rooted in just historical events that has happened, that has impacted the Black community, such as the Tuskegee experiment. And another factor that a lot of people I've heard talked about is the fact that the vaccine came about so quickly. Historically, it takes 2 to 3 years for a vaccine to be produced, but this one, appeared in less than a year. So again, the skepticism that we're hearing, it is validated. However, what I have been encouraging patients and coworkers and anyone who expresses that skepticism is to ensure that you are getting your information from a reliable source, such as your CDC website, such as your trusted healthcare professionals, such as people like myself, nurses and doctors and people of color who you trust. There's so many positive images of people of color, of Black folks like myself, who are advertising the vaccine and encouraging our people to embrace the vaccine. Dr. Corbett, who is an African-American scientist, she was involved in the development of the Moderna vaccine. Dr. Hildreth, he sat on the board of the FDA who approved the vaccine. He is also an African-American, our vice president. So these are just some examples of persons who are Black themselves and considered trustworthy, that our Black folks can take heed from. And I'm just hoping that as we continue to, raise our voices and provide information, that more folks will be willing to embrace it.
Yeah, you mentioned the speed on which the vaccine was developed. We had Dr. James Hildreth, who you mentioned, from Meharry Medical College in Tennessee. He, as you mentioned, he was on the FDA board that approved it, and I remember talking with him back in the fall, and when the former president had mentioned that he wanted that vaccine approved by October, and Dr. Hilger said there's no way that he would sit on a board that would approve a vaccine that quickly. And he was encouraging everyone to be patient, and once the vaccine was approved, to actually take the vaccine. So your point is certainly well taken. The world has surpassed 100 million known virus cases. The true number is probably much higher. The CDC says that they could reopen schools safely if people continue to wear masks and practice social distancing. So, Nurse Cummins, we see a lot of people still refusing to follow those protocols. Give a message to them. And also, we'd like for you to tell us, you mentioned too, we didn't get a chance to ask Dr. Hilton this question because she has had both doses as well. But what was the effect? How did you feel when you took the vaccination? And has there been any side effects?
So I'll answer that question first, Stacy. So when I received both of my vaccinations, the only side effect I experienced was tenderness and just slight pain to the arm that I received the injection in. And that lasted less than 24 hours. Besides that, there were no other side effects. In regards to a message to the masses, it is imperative, it is extremely imperative that we continue to follow the guidelines that are being given, which are continuing to wear our masks, continuing to socially distance, continue to avoid large gatherings. I know that is difficult in our community because we just love to come together, but we have to do our part to ensure that this coronavirus does not continue to spread as rampantly as it does. We need to continue to wash our hands, and we need to continue. Again, I cannot emphasize enough, Stacy, the need to get our information from a reliable source. And as I mentioned before, I'm in no means trying to shame anyone who does not decide to take the vaccine. You have a right to make an informed decision. However, just ensure that your decision is based on or grounded in something that is valuable, something that you can hold on to. A lot of our folks are dying. A lot of, not just our folks, but a lot of people, over 400,000 Americans have died in 10 months because of the coronavirus. And if there is a way to stop it or to at least decrease the spread of it, I think that we should participate in it. And that would be my message to anyone listening.
Yeah. And we hear so much about those who are skeptical, but not because of history, but because of their own pre-existing conditions. Is there a situation, a pre-existing condition that perhaps people should be cautious of before taking the vaccine?
That, Stacy, is on an individual a case-by-case basis. And what I would recommend, if anyone has concerns as to whether their pre-existing conditions or prior adverse effects from any other vaccine may have, I would suggest that they consult their physician, as that is a valid reason. And so they should definitely consult a physician prior to agreeing to take the vaccine.
Yeah, this is fantastic information, Nurse Cummins, and we have so much more this week during our virtual NNPA midwinter training conference. Everyone can sign up at virtual nnpa2021.com. It's no charge. You're going to get a lot of great information about the virus and many other topics. Dr. Chavis, I know you've been looking forward to this midwinter conference. Can you talk a little to Nurse Cummins about
yes,
what to expect?
And Nurse Cummins, again, thank you for your leadership. I'm monitoring on social media all the responses to what you've said thus far, and people are very appreciative that you're taking the time of your experience to share your knowledge and your experience, because that's what we need. You mentioned the importance of having a trusted source of information. We pride ourselves in the NMPA as being the trusted voice of Black America, and that's why we're so pleased to have you to join us as we get the right information out to millions of our people who are still wondering what the facts are. Unfortunately, Nurse Cummins, there's still a lot of myths and stereotypes out there on social media, and a lot of times our people, are misled by misinformation. And sometimes the misinformation has to be balanced and countered. So we just want to thank you, Nurse Cummins. And of course, I think that this interview with you is going so well. I don't want you to think this is a one-time stop. We're going to have to stay in touch with you. You have been given this platform of history, and I think you should continue to use it. Your insights as a practicing nurse are very, very important. We also work with the National Association of Black Nurses, as well as with the National Medical Association. And we're looking for nurses also to join our coronavirus task force. So we're going to be reaching out to you, Nurse Cummins, even after this interview. And we would encourage, Stacey, everyone to tune in starting tomorrow, the 28th and the 29th of January for the public part of the Midwinter Conference of the NNPA. And it's devoted to the Black press responding to the challenges, the opportunities, and responsibilities amidst the COVID-19 pandemic. We've got some great sessions, and we have Dr. LeBird from the Center for Disease Control who will be making an address about COVID-19. And we also have Pfizer, and then Don Cheney is going to be talking about a rare disease, heart disease that affects disproportionately African Americans. So great health as well as other vital information coming forth.
Yep. And Nurse Cummins, you mentioned repeatedly about accurate information, and that, as you stated so eloquently, that is so important. But can you remind people where we can find accurate information on the vaccine? Because a lot of people like to search the web.
Absolutely, Stacey. The best forms of accurate information would be your CDC website and your local departments of health websites, and your trusted neighborhood healthcare provider, like your nurses, your doctors, people that are in the community where you live that actually work in healthcare and receive firsthand information and are privy to research and can share accurate information with you.
Well, we really appreciate it. We really appreciate your time, Nurse Cummins. This has been so informative. Nurse Patricia Cummins, we want to give you that promotion beforehand. The clinical nurse manager at United Medical Center and an MSN student at Walden University. Thank you so much for joining us. And as Dr. Chavis stated, we certainly will be calling you again. I know you've been getting a lot of these requests. Hopefully, we'll get you back.
Thank you so much for having me, Stacey. And I'd just like to give a shout out, if I could, to my university, Walden, because just really briefly, Stacey, I'm actually a student in the Nurse Executive Leadership Program. And I can truly say that through this program, just learning about leadership, and being a transformational leader, just what it means to empower, your followers. And I can say that this education and the knowledge I've gained so far from Walden has truly helped me. You couldn't imagine, as a clinical nurse manager, this is the most challenging time I have ever experienced as a leader, having to empower my staff in the middle of a pandemic when this thing first hit. Doing a reflective analysis back in March, April of 2019, we hadn't seen anything like this, not having enough PPEs, hoarding PPEs just to make sure that my staff has adequate, trying to boost the morale. All of this is new, but we have made so many strides since then to now. We've learned so much. We have a lot more information, and I'm just grateful for where we have come and I am hopeful and expectant about a better future. Everyone said 2020 was a horrible year. I don't know about it being horrible, but I do know that we've lost a lot of lives, but we've also learned a lot, and it has caused us to be more resilient. And my hope is that the Biden-Harris administration also helps in this venture by the plans that they seem to have in place as far as really getting ahead on ending this pandemic. So again, thank you so much for having me, and be
Yeah.
safe, stay
Well,
safe.
we thank you, and thank you for those expressions, because oftentimes, Nurse Cummins, when we talk about this, we forget about the fact that you are a frontline worker. We forget about the frontline workers and how the toll it takes on you. And if you got another minute, I do want to ask you that, since you brought that up. There's a twofold question, really, because you mentioned the Biden-Harris administration, but when you have an administration like the previous administration, that Dr. Fauci and Dr. Birx even has come out and said that they just gave so much misinformation. How frustrating is that for you in trying to save lives? And also, when you go home, how much of this do you take home with you?
Well, quite frankly, and again, just going back to Walden and just everything I've been learning, I have learned and tried my best to isolate my work environment once I get through the door, Stacy, because I'm a single mother of 2 children who are studying virtually, are in virtual school. And so it's just really crucial learning time management and learning how to balance my responsibilities. But yes, there were times where it was extremely frustrating. To answer your other question, you know, just the mere fact that it was claimed that more information was known but was not shared with the public as far as the deadliness of the virus and other interventions that could have, I don't know for sure, but possibly could have been put in place sooner, and perhaps influenced a more different outcome as far as the number of deaths that we saw, etc. But what I will say is that I'm grateful we're not going back. I'm grateful for where we are now. And my hope is that, like I said, that the task force that is now in place has a better plan and will move us forward successfully through this.
Well, again, we appreciate you so much. Nurse Patricia Cummings, United Medical Center, and an MSN student at Walden University. Thanks so much, Nurse Cummings, and we will see you again. Dr. Chavis, it's quite a morning of information from 2 fabulous professionals. What do you gain from all of this, Dr. Chavis? What should our viewers gain from all of this?
Well, thank you, Stacey. I believe that the information that we are put out this morning from Dr. Hilton and from Nurse Cummings is vital information. And this is the role of the Black press of America. I'm so proud of the National Newspaper Publishers Association as we recognize the 194th year of the Black press. We're getting ready to go into our midwinter conference, training conference, where we're going to be dealing with a number of issues. And one of the issues is the question of COVID-19 and how we can get more facts, more information that's vital to the quality of life of our community, to Black people and to all people who deserve to know the truth. So I think that this is a reaffirmation, Stacey, of why the Black press is needed, why the Black press is trusted. And of course, we're going to continue to have these programs. We're live Monday through Friday, every morning at 7:30 a.m. Eastern Time. And Stacey, you're doing a great job with Let It Be Known. Thank you for coming up with this concept so that we can not only stay relevant, but put out that news in a way that impacts and give our people what they need, not just to survive, but to thrive and to help overcome this deadly pandemic that disproportionately impacts Black people and other people of color in America. And of course, it's a global pandemic. It's impacting our brothers and sisters all over the world. But we're going to make more progress now, I believe, Stacey, in some, with the new Biden-Harris administration and having nurses like Nurse Patricia Cummins, having physicians like Dr. Ebony Hilton. I think it gives us a sense of rededication, a sense of refortification, and we've all talked about the resilience of our people. But it's good to have brothers and sisters who are health professionals, who are in place, and who can bring us the actual facts. So thank you very much on behalf of the NMPA.
Well, it's certainly a privilege, Dr. Chavis. David Youngblood is asking us, do we have a NMPA White House correspondent? Absolutely, David. We are going to be giving you news constantly from the White House. In fact, the White House sent something this morning, Dr. Chavis. They're going to have a briefing with their COVID-19 team. They've invited the Black press. We will certainly be there. David, thanks for asking that. David is a loyal viewer. We are so proud. We actually had David on the program. We look forward to having him again sometime in the near future. But this has been fabulous information for all, as you said, Dr. Chavis, all of Black America. We certainly thank you for your leadership, Dr. Chavis. Thank our chair, Karen Carter Richards of the Houston Forward Times, who's been given some outstanding leadership over these past year and a half, especially during a pandemic. And certainly Claudette Perry, our executive administrator, deserves so much credit. You talk about somebody, they said James Brown was the hardest working man in show business. She's the hardest working woman in news. And then we have our producer, Enchanta Jackson, who jumped in an emergency, Dr. Chavis, and took over and has been doing such a fantastic job. And of course, Norman Rich has always really done an outstanding job for the Black press. The Black press is so proud of the entire team. We look forward to tomorrow. We're going to talk tomorrow morning on Let It Be Known, the executive orders that President Joe Biden signed yesterday, some landmark orders, and we're really going to talk about that. We're going to dig into that tomorrow morning. So remember this: medicine is a science of uncertainty, but it's an art of probability. Let it be known. We'll see you tomorrow morning.